Okay, we're going to talk about nutrition next. We want to make sure that our pediatric population has a balanced diet plan. We want them to eat at regular intervals, don't skip meals. So the bottom line, they should have somewhat of a consistent diet. Make sure they have a certain amount of carbs per snack or per meal. We count grams of carbs consumed. So 15 grams of carbs equals 1 carb exchange. And 1 unit of insulin covers 15 grams of carbs. So we kind of have, well, we have them count their carbs, what are their carb exchange, and that's how much insulin they give themselves to cover their meal. If it would be appropriate, we would restrict calories and encourage physical activity. Again, I see that being more with your type 2s, although we are seeing some type 1s who are presenting as a little bit huskier of a stature than what we normally see. Fiber, we want to make sure they have fiber in their diet. It controls their cholesterol level and it increases their carbohydrate metabolism. We want them to avoid concentrated sweets, and we also want them to use artificial sweeteners, but again, use them sparingly. We had our discussion about artificial sweeteners and what we're putting into our body and what the downside of all of that is. Some things to consider when we're talking about their nutrition is their age and peer pressure. Think about a teenager's diet. And again, we've talked about the older we become as a kid, the more we want to be like others. So we want to eat like everybody else. And our diabetics cannot eat like everybody else. So make sure that we are considering their age and what's going on in their life when we talk about nutrition. Level of development, again, how old are they? Can they count their own carbs and figure out their own insulin? Do they understand what they're doing? So make sure you're taking into that. Activity, extra activity should result in extra food. So make sure their diet is meeting their activity level. What are their likes? What are their dislikes? And again, when you have a pediatric diabetic, it's going to affect the whole family. How are the family's eating habits? Is the diabetic going to be the only one that's eating balanced, nutritious meals? Well, the rest of the family is eating whatever they want, cake, ice cream. So it is going to affect the whole family. And don't forget, kids always growing and developing. We always have to reevaluate their nutrition plan for adequacy as they are growing. All right, let's talk about their nutrition when they're sick. We already talked about how we're going to bump up testing their blood sugar when they're sick. We said every 3 to 4 hours or more frequently if needed. Big thing, if they're not eating because they don't feel well, hopefully we can encourage fluids because we want to keep them hydrated. We just talked about how important fluids are for our pediatric population and how sensitive they can be to dehydration. So hopefully we can at least hydrate them. They should consume 4 ounces of a sugar-free, non-caffeinated liquid every half hour. If they're not eating because of a minor illness, a calorie-containing liquid to supplement as a meal would be fine. I know we're all familiar with Ensures, and there are pediatric Ensures that they can do, but there's also the diabetic version of Ensure where it does have a decreased amount of sugar in it. So that would be something we could do as well. Soft, bland foods, again, to meet their carbohydrate needs. Again, we talked about if they were unable to consume food, they could consume liquids that are equal to the usual carb content of their diet. Make sure that our pediatric patients, as well as our parents, know that they shouldn't be skipping a dose. Just because they're not eating doesn't mean that we're not going to give insulin. A lot of times when they're sick, that's a stressor on the body, and actually they may need more insulin to cover their blood sugar. So just let them know that there could be dose adjustments. We could be giving them more. They could be requiring less, but bottom line, don't skip doses. Check that blood sugar and let's see what the blood sugar is doing before we decide not to give any insulin when they're sick. All right, our next topic here is exercise. We encourage everybody to exercise, but for our diabetic patients, it does improve their blood glucose control. So it will decrease the amount of medication they need to keep that blood sugar in check if they're exercising. And don't forget, for everything that we put in our body, there is a trade-off. And again, I know insulin is naturally occurring in the body, but if we are needing to put more and more insulin into our body, that might be an indicator that we're not controlling other areas that help that blood glucose. So just make sure we're always aware of that. Exercise also reduces cardiovascular risk. We saw cardiac mentioned in the progressive and long-term complications section. And then again, we talked about if our diabetic patients do need to lose some weight, exercise will contribute to that. All right, the norm for our diabetic patients in exercise is an extra snack before activities. We want 15 to 30 grams of carbs that will help decrease the risk of hypoglycemia. We already talked about how exercise will lower the blood glucose. It will then decrease the amount of insulin required. Team sports, if they're involved in a team sport, anything with an increased activity is going to lower that blood sugar even more. They are more active in the summer, so maybe we need to give more of a snack. If they should check their blood glucose prior to exercise. And remember, we said our high was if it was greater than 240. So if it's greater than 240, they should restrict exercise. And then also if their blood glucose is getting into the 240 range, we want them to check their urine as well for ketones. And obviously they would call their physician. All right, the next thing we have got to talk about is insulin. There's a lot of teaching with insulin in our pediatric patients. Again, we got to look at their nutrition, we got to look at their exercise, and then we got to teach them how to monitor all of those things before we even get to the insulin. So lots and lots of teaching here. Don't forget all of our insulins. We look at the onset, the peak of the duration, depending on what type we're doing. Are we mixing regular with NPH? What are we doing? So make sure you're tailoring the education based on the type of insulin. Some research has shown that a daily basal bolus dose of insulin has resulted in improved glycemic control in the pediatric population. We need to teach them, make sure, one, do they have the fine motor skills needed to draw up the insulin or to use a pen. I believe in our pediatric sites, we're seeing more and more of the insulin pens being used, which is great, but again, make sure they know how to use it. Do they have those motor skills necessary to dial the pen? Can they read the pen? So make sure we're doing that, or that they're doing that. And then again, how do they make sure we're teaching them how to administer it? Do they do their own administration? Again, by the age of 7, hopefully they are. Don't forget about your technique for administration. Are we going at a 90-degree or 45-degree angle, rotating sites? We talked about insulin when they're ill, checking their blood sugar. And don't forget, some of these kids could even have a pump. So an insulin pump might be used versus doing injections. And then you guys might want to remember that the peak effectiveness of regular insulin is 2 hours after the administration. The duration of regular insulin is 4 to 6 hours. And the onset of regular insulin typically kicks in at around the 30-minute mark. There's some other things to consider when we're doing insulin. How do you store the insulin? If we're using syringes, how do they dispose of them? The same thing with our insulin doses. We're always reevaluating and readjusting about every 2 to 3 months due to growth, okay? We're reiterating that they might need more insulin when they're ill, even if they're not eating. We need to watch all medications for sugar. Think of how the younger the child, all of their medications are liquid syrup-based. Those syrup-based medications are high in sugar. We have to look at any religious, cultural aspects. Are there any restrictions in their diet? Some insulin is made for pork. We know that some cultures, some religions don't eat pork, so we need to make sure that we're looking at all aspects, because bottom line, we need compliance. The sooner that they start managing their diabetes on their own, the more success they're going to have aging and having decreased progressive and long-term complications. And make sure that you are prepared for your questions, because they're going to ask tons of questions, especially anytime a kid knows that they have to take an injection. They're not going to want to do that. They're going to want to say, why can't I drink it? We would, again, make sure you're toning your answer to the appropriate age, but basically because it's a protein and all of the juices in your belly will break it down, because insulin is broken down. It would be broken down by gastric juices if they were to swallow it. Why can't I take pills? I see my grandparents taking pills for their diabetes. Again, kind of let them know, you know, the difference between what the pills do and what insulin does, and why they are requiring the insulin. There are some, hold on, let me flip the page here. Let me see where we're at. Okay. Oh my gosh, you guys, I should have been flipping the whole time. Sorry. We considered those things. We talked about the, okay. Self-care, hygiene, oral care. We need to treat cuts and scrapes, where in any other kid, we might just wash them, leave it open to air, but we know that our pediatric population is more susceptible to infection, so we're gonna clean it, dry it, put a dressing on it. Endocrinologist, foot care. Again, the big thing with kids running around bare feet, no bare feet, and make sure they're wearing shoes. Eyes, remember annual appointments to the eye doctor. If they notice any visual changes, we'll probably be going to the eye doctor twice a year. As they get older, it might be a little bit more. Dentists, make sure they are wearing an ID band. A medical alert bracelet is kind of what I'm talking about there with the ID band. And again, the I don't know if you guys have seen any ID bands lately, but they actually are kind of more like a bracelet. They're more fashionable. We talked about kids not wanting to stand out. They want to kind of look like everybody else. So the ID bands have come a long way. So they help meet that need.